Hello, I am urologist Omer Erdem. Today I will talk about varicocele. Is varicocele surgery a necessary surgery? This is one of the most asked questions, friends. It is really necessary when we do it in a suitable patient. According to what can we say necessary? If the sperm quality is bad, if the patient has infertility, if there is shrinkage and softening in the testicle, then varicocele is a necessary surgery. Why? We put the patient's condition on a scale of classical medical ethics. Will the patient's condition be better if it remains as he is, or will he be better if there is an operation? If the patient's condition will worsen if we leave the patient without surgery, we perform varicocele surgery. If we recommend varicocele surgery to the patient, there is a reason. If we don't do it, there will be a problem, the patient will have problems later. Varicocele surgery is a very old surgery. It is a surgery that has been performed in the world for about 100 years. It is a surgery with known long-term results, complications and risks. For example, unlike premature ejaculation surgery, it is not an operation that has been performed for 5 to 10 years. Or it is not an operation with unknown long-term results such as venous embolization. The threads used to embolize the patient after venous embolization surgery sometimes go to the heart, sometimes to the lung. So the long-term consequences are not clear, friends. But the long-term results of the surgery we call classical varicocelectomy are very clear. The effect on infertility, testosterone, hormonal structure is very clear, friends. Therefore, it is a procedure that we apply with confidence. Are there any complications? This is the most frequently asked question. Will there be shrinkage in the testicle? Friends, the possibility of shrinkage in the testicle is maybe 1%, maybe 1 in 1,000. So it is a very low possibility. Is there a possibility of hydrocele development? It is a very low possibility, friends. I have been performing varicocelectomy for 25 years. How many of my patients have had hydrocele? Maybe 1 or 2 patients, I don't even remember. Testicle shrinkage is a very rare condition, friends. It has never happened to me. But can it happen? It can happen. But it is very rare, friends. Why doesn't it happen? Because we detect the artery feeding the testicle. We detect it either with a microscope or with microdoppler. We have been using microdoppler for a long time now, and I think it is much more valuable than the microscope. Because the microscope does not always show us the beating artery. The operating room environment is cold. The devices we use are cold. Therefore, the artery can shrink. Because arteries are very mobile, their diameter can narrow and expand rapidly. When the diameter narrows, you may not be able to find the artery. But Doppler shows us this clearly. Because we use these devices, atrophy no longer develops. Since it is beneficial, we are obliged to recommend varicocele operation to the patient. So we are also legally obliged. If I advise the patient not to have an operation and tell him that he will not have problems in the future, but the patient becomes infertile in the future and takes legal action, I would be legally responsible and guilty. Therefore, we have to recommend this operation in order to ensure the patient's well-being. We have certain criteria before performing varicocele operation. After passing certain criteria, we tell the patient that you are a suitable individual to have this operation. But we do not have a 100% chance of knowing exactly which patient will benefit from varicocele surgery. We have certain criteria. For example, infertility, poor sperm quality. The fact that the degree of varicocele can be clearly detected in physical examination. Without the need for ultrasound are important criteria for us. Patients who meet these criteria are much more likely to benefit after surgery. So what do I do? In order for the patient to benefit even more, I first perform the Doppler that will also be performed by radiologists on a patient myself. This is valuable for me to make an operation plan for the patient. What should I pay attention to during the surgery? How many arteries does the patient have? What can I do while protecting them? After performing these Doppler, I make my operation plan myself. I perform the operation using Doppler and under a microscope. After the operation, I follow up the patient's condition by performing Doppler again in the follow-up. This is a surgery I have been doing for 25 years. What is our hope after the surgery? Our aim is to detect an improvement in the volume and consistency of the testicle, an increase in testosterone, an improvement in sperm quality, and if the patient has pain, to improve it. This is the answer to the question of whether varicocele requires surgery. If varicocele meets the criteria for surgery, surgery is absolutely necessary in the patient. Thank you for listening, best regards.